As new coronavirus cases climb across the country, many are concerned about pausing in-person learning, opening up businesses, and elective procedures. But others say not so fast. Medical reporter Liz BONIS explains why.
Hey everybody, hello to you. As we hear more about the climb in numbers of cases, infection control specialists and those who work in patient care say there are some critical differences this time around. Here's what they say we should know about those differences.
I don't know if I would call it a surge. I think, we talked about from the very beginning of this that if we controlled the pandemic well, we would see what I call wavelets.
The first thing to know is that this time around, there is much better preparation in most parts of the country. That means in those community war rooms all across the nation, infection protection specialists are stepping it up.
We have increased the frequency with which our command center meets up to 2 times a week instead of once a week.
They are not suggesting right now that we shut down things such as elective surgeries or safe activities.
We're concerned about it, but we're going to continue to monitor it and implement the measures that we've been using for the entire time.
The second thing to know is that there is far more personal protective equipment available to use and be shared by healthcare systems, and better communication to know who needs it.
What's different about the situation today is that almost every system has ample supply of some of those key protective devices and equipment.
Third thing to know is what President Trump told Sinclair's Eric Bolling at this White House town hall.
We're going to have a vaccine very soon, and we have therapeutics that are fantastic. We have, meaning things that help you get better.
The one caution on that, according to Dr. Stephen Blatt.
Even though we've become better at treating COVID, the mortality rate is still much higher than it is with the flu.
Finally, what's important to know is that we have a better idea right now of when people should go seek medical attention for COVID-19. So take, for example, remdesivir. While it doesn't appear to be effective in late-stage complications,
I think probably the earlier you can give remdesivir, the more likely it is to do some good.
Now, one other reason to identify when to go get care is important is that there are lots of other things going around right now. Viruses, the flu, other coronaviruses or colds. So getting proper diagnosis and a treatment plan can put you on the path to better health. I'm medical reporter Liz BONIS. We'll throw it back to you.